My name is Nancy Mike.
I am Sapora Merns.
My name is Mariah Salafi.
I'm Dr. Gwen Healy Akeago, and we're in the Qaujigiartiit Health Research Center in our community of Iqaluit. So we have people working in a variety of positions here at Qaujigiartiit. So we have, a director of our post-secondary early career researcher program. We have evaluators and analysts. We have interviewers and project coordinators, scientific leads, and part-time research assistants. We have students doing their practicums. We will support any Nunavummiutak who comes to us with a project idea, with a desire to learn more. We'll work to find the right fit for them.
What we like to do is hear from our community members, whether it be individuals, organizations, families, the community as a whole. QHRC has utilized Qaujigiartiit, or as we would say in English, working for the common good, in our Qaujigiartiit partnership model. It helps us to do research and also broaden our capacity in our partnerships with different organizations, or that's kind of our base of how we collaboratively work with people. It's definitely different than, say, when you get a phone call from at home, like someone's doing research. It's not really like that. It's more hands-on. Majority Inuit in Nunavut, it's very important that we are culturally competent in the way we do things, and when we're using Inuit values or the Maligate, maintaining harmony and balance, how do we utilize that in a workplace, or what they do to have a better life or to improve their lives.
We were experiencing so much research being done in our territory about Inuit, not by Inuit. So, helicopter researchers coming from the south, coming in, gathering their data and leaving. And that research not staying in our communities and not benefiting our communities. And so that's how Qaujigiartiit came to be. We wanted a center that does research by Nunavummiut for Nunavummiut.
Our work is really focused around improving the health and well-being of Nunavummiut. Being here to answer questions that we are receiving directly from Nunavummiut.
What we want to be able to do is create spaces that is inclusive of everyone. We want Inuit to feel empowered in their identity and feel empowered that they have knowledge to share.
I'm Christine Tutu from Rankin Inlet, Nunavut. The next exercise is called Wayalna.
Where we started is we were just doing research, like answering questions and finding the methodologies, from our communities that would answer those questions. And then those answers, became solutions. So all of these solutions then evolved into the programs we have today, and that right now focuses on youth mental health and well-being through community and land-based programs. It focuses on sexual health and relationships for our young people through the arts and the ways we express our well-being, and then working to support our parents to reconnect with knowledge from previous generations on, Inuit philosophical approaches to child rearing and how that works in the environment we're in today. As more research takes place and as more community members come forward to work with us on elevating different practices into our healthcare systems.
I'm Lilia Mawalik, and I'm one of the facilitators for the Inuit parenting program. We incorporate a lot of Inuit Qaujigiartiit in our program. It's very important that they're able to understand it and bring it to their communities. The strongest feedbacks that we get are when families come back throughout the week and say, wow, like I did this activity with my children or my family, and my kids you could see a big difference even just in a few days, how the program has changed the environment in our home.
As we've grown, we've needed more space, and then now, we're working on this initiative to build an entirely not-for-profit building. As nonprofits, we're competing for gym space, for a school kitchen. This is the reality of our communities in Nunavut. And so what we have in the building is community services and programs are working together under one roof. We want the hub to be the place for all of these things. We hope it will be a replicable model for other communities, that space is essential. So we're not just a center that collects information and houses it in an archive. We, as community members, are obligated, I feel, to take what we're given as solutions. We then take action with the information we have to make everything more accessible to our communities, to elevate the pathways of well-being that exist in our communities. Part of what we do is we push to have those systems, bend over toward, like a blade of grass in the wind, just come a little closer and work with us. We have the tools, we have the capabilities as Nunavummiut to address the challenges we see around us and to elevate the strengths that are ingrained in our way of living. We have it all within us. We just need to bend that blade of grass, toward us, bend the system toward what we're doing.